Welcome back to the YouTube channel Breastfeeding Nurtured, All You Need to Know. In our previous session, we explored hormonal regulation in breastfeeding and discussed the importance of a proper latch, which is crucial for effective breastfeeding and for preventing issues such as nipple pain and poor milk transfer. Today in session 4, that is breastfeeding, perfecting the art of positioning and effective latching, we will focus on the best practices and techniques for positioning. Positioning refers to how a mother holds her baby at the breast with particular attention to the alignment and placement of the baby's entire body. These aspects are crucial for ensuring a comfortable and successful breastfeeding experience. Assisting a mother in positioning her baby for breastfeeding can be crucial, especially for those who are new to breastfeeding or are experiencing difficulties. Proper positioning can help ensure a good latch, which is essential for effective feeding and to prevent issues like nipple pain or inadequate milk intake. There are three primary types of mothers you might need to assist. One are the first-time mothers who are new to breastfeeding. They may feel overwhelmed and uncertain about the process. Providing them with guidance and support can help them establish a positive breastfeeding experience from the start. This includes teaching them about proper latching techniques, comfortable breastfeeding positions, and addressing any initial concerns or questions they may have. Second are the mothers encountering challenges with breastfeeding or employing improper techniques. They may also experience pain, low milk supply, or difficulties with the baby's latch. Others may not be using the best techniques, leading to ineffective feeding sessions. Identifying these issues early and offering practical solutions, demonstrations, and encouragement can make a significant difference in their breastfeeding journey. This support can improve their confidence and help them overcome common obstacles. Third are the mothers who previously formula fed their babies but now wish to try breastfeeding may need an extra encouragement and education to transition successfully. Providing information about the benefits of breastfeeding as well as practical tips for initiating and maintaining breastfeeding can help them feel empowered and supported in their decision. Understanding their unique perspective and previous experiences with feeding can tailor the assistance provided to meet their specific needs. However, it's important to remember that not all mothers may require assistance with positioning. Experienced mothers or those who have successfully breastfed before may already be adept at positioning their baby correctly. It's important to assess each mother's needs individually and provide support as necessary. Now, to effectively demonstrate helping a mother position her baby for breastfeeding, it's crucial to first understand the guidelines that empower her to position independently. Observing the mother breastfeed is of utmost importance before offering assistance. Politely request permission from the mother to observe her breastfeeding. Explain that you want to see how she usually breastfeeds so you can provide better support. Encourage her to position the baby as she normally does, which will allow you to accurately assess her current technique. Understand the situation by carefully observing how the mother holds her baby, noting if the baby is held loosely away from her body or with the neck twisted as shown in the picture. Take a few moments to assess her breastfeeding technique without rushing to suggest changes. Be mindful of other factors such as her clothing or the presence of men in the room, which might influence her breastfeeding experience. More details will be discussed in the next slide. Building confidence involves speaking gently and offering encouraging words to boost the mother's self-assurance while creating a supportive atmosphere. Clearly explain what you are doing so she fully understands your actions and suggestions. Make sure the mother is sitting in a comfortable and relaxed position. Provide assistance if the mother encounters difficulties. Address any immediate issues and help those who may not have apparent problems but are using poor techniques, especially in the first 2 months. For example, if breastfeeding is painful, explain that it might be less painful if the baby takes a larger mouthful of breast when suckling. Ask if she would like to demonstrate, and if she agrees, proceed to help her. Then encourage independence to empower the mother to take as much initiative as possible while ensuring that she understands how to replicate the actions on her own. Avoid taking over and ensure that she manages breastfeeding independently. Facilitating effective positioning involves prioritizing assistance to help the mother position her baby correctly. The ultimate goal is for her to master this on her own rather than just relying on you to achieve a correct latch in the moment. For mothers with babies over 2 months who are breastfeeding well, there is no need to change positions if the baby is thriving and the mother is comfortable. Before you proceed to help a mother who is sitting, it's important to choose a comfortable position for yourself. It is wise to sit in a comfortable and convenient position when assisting the mother. If you are uncomfortable or in an awkward position, it can be challenging to provide effective help. Ensure that you are not bending over the mother, as this can make it difficult to demonstrate proper techniques and provide support. As you find a comfortable position for yourself, it's also important to recognize that mothers have various preferences for feeding their child while sitting. A low seat is often preferable for breastfeeding. It should at least support the mother's back to help her maintain a comfortable and relaxed posture. A seat that is too high might cause discomfort or strain, making breastfeeding more difficult. If the available seat is high, use a stool for the mother to rest her feet. This adjustment helps ensure that her knees are not too elevated, which could position the baby too high relative to her breasts. Proper alignment is essential for an effective latch and comfortable breastfeeding experience. When the mother is sitting on the floor, ensure that her back is well supported. Use cushions or pillows to provide adequate support and prevent strain. A supportive back position is crucial for maintaining comfort and avoiding fatigue during breastfeeding. If a mother chooses to support the baby on the knee, help her position the baby high enough so that she does not need to lean forward to bring the baby to her breast. This positioning helps facilitate a better latch and reduces the risk of back or neck strain for the mother. After ensuring that both you and the mother are comfortably positioned, the next step involves evaluating a breastfeeding mother to determine whether she requires assistance and the type of support she may need. Valuable insights into the effectiveness of breastfeeding can be gained simply by observing even before asking any questions. We will now discuss how to evaluate a breastfeeding mother. Once you have made the mother comfortable, observe the mother before she begins breastfeeding. Observe her age, overall health, and nutrition, which give insights into her life situation and potential challenges in breastfeeding. Her expression and demeanor are also important. If she appears happy and content, she is more likely to breastfeed successfully. However, if she seems unhappy or tense, it may be more challenging for her to breastfeed effectively. Comfort and relaxation play a key role in the breastfeeding process. Next, we need to observe how does the mother manage holding her baby. If the mother holds her baby close and facing her breast, it's easier for the baby to latch and suckle effectively. However, if the baby is held loosely or with his head turned away, it can make breastfeeding more difficult. A mother who holds her baby securely and confidently helps facilitate effective suckling and milk flow. In contrast, nervous or unsure handling may disrupt the baby's feeding and the mother's milk supply. Signs of bonding such as looking at, touching, and talking to the baby support successful breastfeeding. A lack of these behaviors might indicate bonding issues leading to breastfeeding challenges. In addition to evaluating the mother, examining the baby is also a part of assessing the breastfeeding process. Next, evaluate the baby before he is positioned at the breast. It's important to assess the baby's overall health, nutrition, and alertness. Additionally, watch for any conditions that might hinder breastfeeding, such as a blocked nose, breathing difficulties, thrush, jaundice, dehydration, tongue tie, or a cleft lip or palate. These issues can impact the baby's ability to feed effectively. It's also important to observe the baby's response when the mother initiates breastfeeding. A young infant may root for the breast by turning his head, opening his mouth, and reaching out, which indicates readiness to feed. Whereas the older baby may turn towards the breast and reach for it with his hand, showing a desire to breastfeed. On the other hand, if the baby cries, pulls back, or turns away, it suggests reluctance to breastfeed, indicating a potential problem. If the baby is restless, slips off the breast, or refuses to feed, it could mean he is not well attached and may not be receiving enough breast milk. A calm demeanor during feeding, followed by relaxation and contentment afterward, is a good sign that the baby is getting sufficient breast milk. As you continue to observe the breastfeeding process, it is important to look at the way mother positions her baby at the breast. If the mother is pushing her nipple into the baby's mouth or pinching it, it can make it harder for the baby to latch properly. Ideally, the mother should bring the baby to her breast, supporting the entire breast with her hand if needed. Shaping the breast with her thumb can help the baby latch more effectively. While assessing a breastfeed, mother also needs to be watched the way she handles her breast during a feed. Holding the breast too close to the areola can hinder the baby's ability to suckle and may obstruct the milk ducts, making it harder for the baby to receive milk. Holding the breast away from the baby's nose with her finger is generally unnecessary. Using the Caesar hold or cigarette hold, where she pinches the nipple and areola between her index and middle fingers, can make it difficult for the baby to latch properly and may block milk ducts. Supporting the entire breast with her hand against her chest wall is usually beneficial, particularly for the mothers with larger breasts, as it facilitates effective suckling. You must have a fair idea about the baby's attachment from the previous session. To further ensure effective breastfeeding, it's important to accurately assess the quality of the baby's attachment to breast and observe the following aspects. Based on your understanding of the baby's attachment from the previous session, it's crucial to accurately assess the quality of the baby's latch for effective breastfeeding. Pay close attention to the following aspects. That is, mouth opening. A good attachment is characterized by the baby's mouth being wide open. This wide gap is especially important for the mothers with larger breasts, as it allows the baby to take in a substantial amount of breast tissue, facilitating effective milk transfer. On the other hand, if the baby's mouth is not sufficiently open, particularly with the larger breasts, it can result in a shallow latch, making feeding less efficient and potentially causing nipple pain. Next is the lower lip position. In a good attachment, the baby's lower lip should be turned outward, creating a secure seal around the breast. This outward turn helps in maintaining a strong and effective latch. However, if the baby's lower lip is turned inward or pointing forward, it could indicate a poor latch, which might compromise the seal, leading to less effective suckling and potentially causing discomfort for the mother. The third is the chin position. When the baby is well attached, their chin will be in close contact with the breast. This close contact ensures the baby can latch deeply, allowing them effectively draw milk from the breast. In contrast, if the baby's chin is not touching the breast, it could indicate a shallow latch, which might hinder the baby's ability to feed effectively and could lead to discomfort for the mother. Then comes the areola visibility. For a well-attached baby, more of the areola, the dark area surrounding the nipple, should be visible above the baby's mouth than below it. This suggests that the baby has taken in a large portion of the breast tissue, ensuring a deep latch and effective feeding. Conversely, if more of the areola is visible below the baby's mouth, or if the visibility is equal, it might suggest that the baby has not latched deeply enough, which can lead to inefficient feeding and possible nipple discomfort for the mother. These observations are crucial in ensuring that the baby is effectively nourished and the breastfeeding experience is comfortable for the mother. When observing the breastfeeding baby, it's also important to look for these specific signs that indicate effective suckling. Slow, deep sucks. This is a positive indicator that the baby is receiving breast milk, demonstrating good attachment and effective suckling. Typically, a baby will begin with a few quick sucks to initiate the oxytocin reflex, which triggers milk flow. Once the milk begins to flow and fills the baby's mouth, their sucking pattern will slow down and deepen. After a brief pause, the baby may start again with a few quick sucks. Quick, shallow sucks. It's a sign that they are not effectively receiving breast milk. This suggests poor attachment and ineffective suckling. Observing or hearing the baby swallow is a clear indication that they are successfully getting breast milk. Swallowing can sometimes be heard, but it might be easier to see the baby's throat moving as they swallow. If the baby makes smacking sounds while sucking, it's a sign of poor attachment. Hearing the baby gulp as they swallow is another sign that the baby is receiving breast milk effectively. These observations are crucial for assessing whether the baby is effectively suckling and receiving the nourishment they need. Imagine sucking your own fist with your mouth wide open, your tongue positioned forward and your lower lip curled outward. This would involve slow, deep sucks, approximately 1 per second, which can be correlated to good attachment with effective suckling. Now imagine sucking on your thumb with your mouth almost closed, your lips pointed forward, and your cheeks drawing inward. This would involve quick, shallow sucks and is evident when the baby is poorly attached and not getting milk effectively. Once you have identified the signs of effective suckling, the next step is to observe how a breastfeed session concludes. A breastfeeding session usually concludes when the baby is naturally releasing the breast, appearing content, and often sleepy. This is a sign that the baby has received enough milk from that side. Sometimes the mother may interrupt the feeding early, perhaps because the baby pauses and she assumes he is finished, or because she wants to switch to the other breast. However, if the baby is taken off the breast too soon, he might miss out on the hind milk, which is rich in fat and essential for growth. As a result, the baby may not be fully satisfied and could want to feed again soon. To determine if the baby is content after feeding, observe how long the feeding lasts and how the baby behaves afterward. A baby who is satisfied will usually release the breast on his own and appear calm and sleepy. While the exact length of the feeding isn't crucial, very short sessions, that is under 4 minutes, or excessively long ones, that is over 30 minutes, might indicate a problem. However, longer sessions in the early days of breastfeeding or with a low birth weight baby are typically normal. In addition to evaluating the duration and contentment of breastfeeding session, consider the size and shape of the mother's breasts and nipples. While all breast sizes are suitable for breastfeeding, some mothers may feel insecure about their breast size, which can affect their confidence. Additionally, certain nipple shapes might make it more challenging for the baby to latch properly. It's also essential to check for signs of an active oxytocin reflex, such as milk dripping or spraying from the breast. This indicates that the reflex is working well, though the absence of these signs doesn't necessarily mean there is an issue. Uterine pains, known as after pains during the first few days of breastfeeding, are another indicator of an active oxytocin reflex. Observe whether the breasts are full before feeding and soft afterward, which shows that the baby is effectively removing the milk. Constantly full or engorged breast might suggest the baby is not feeding well. Healthy skin on the nipples and breast is a positive sign, while redness, fissures, or a squashed appearance of the nipple after feeding could indicate poor attachment. Additionally, ask the mother about her breastfeeding experience. If she feels comfortable and pleasant, the baby is likely well attached. However, if she experiences discomfort or pain, it may be a sign that the baby is not latching on properly. Let's take a closer look at some examples to visually assess breastfeeding attachment. Pay attention to specific signs that indicate a good latch, such as the following. The baby's mouth is wide open, which allows the baby to take in a substantial amount of breast tissue. The baby's lower lip is turned outward, which helps in creating a secure seal around the breast. The baby's chin is nearly touching the breast. A close contact ensures a deep latch. More areola is visible above the baby's upper lip than below the lower lip. This suggests that the baby has latched deeply and effectively. In addition, the baby is positioned close to and facing the breast with rounded cheeks. These visual cues confirm good attachment and positioning, ensuring that the baby is feeding well. Now let's examine some examples of poor attachment. In this picture, signs of poor attachment are distinctly visible. The areola is not easily noticeable. This shows the baby has not latched deeply enough. Though the baby's mouth is wide open, but it is pointing forwards. This suggests a shallow latch. The lower lip is only partially turned outward. This affects the seal around the breast. The baby's chin is not in contact with the breast. This also indicates a shallow latch. The baby's cheeks are drawn in while suckling. This is a sign of ineffective suckling. Additionally, upon closer examination, you will notice that the mother is using a scissor hold to support her breast. While this hold can sometimes hinder effective suckling, in this case, her fingers are not near the nipple, which may contribute to poor attachment observed. This is another example of breastfeeding which exhibits several signs of poor attachment. The baby's mouth is not wide open and the lips are pointing forward rather than flaring outward. While the lower lip is turned outward, the chin is not in contact with the breast, which is crucial for deep latch. Additionally, the areola is either equally visible or more prominent below the baby's mouth than above it, indicating a shallow latch. Further observation include the baby's round cheeks indicating that he is not close enough to the breast. The baby's hands are positioned in a way that suggests his body is twisted away from the mother rather than facing her directly. These indicators show that the baby is poorly attached and positions incorrectly. The baby's posture and manner of feeding resemble that of a bottle-fed infant rather than one breastfeeding effectively. This slide presents another example of baby which shows clear signs of poor attachment during breastfeeding. The mouth is not wide open and the lower lip is pointing forward rather than fully outward. The baby's chin is not making contact with the mother's breast and the amount of areola visible below the baby's lower lip is equal to or greater than that above the upper lip. These signs indicate that the baby is not well attached to the breast. Additionally, the baby's cheek appears slightly drawn in and the baby's body is not positioned close to the mother. A further observation about the mother's areola reveals that it is quite large. Even if the baby were properly attached, you might not see much of the areola, but it should still be visible more above the baby's upper lip than below the lower lip. This slide shifts focus on evaluating a breastfeeding session, which allows you to determine if a mother requires assistance and guides you on how best to support her. Explain to the mother how to hold her baby properly and, if needed, demonstrate the correct positioning. Ensure that the mother understands the four key signs of good positioning. 1. Baby's head and body aligned. The baby's head and body should be in a straight line. If the head is twisted or bent, the baby may struggle to suckle or swallow effectively. Second is that the baby held close to the mother's body. The baby needs to be held close to the mother's body to attach properly to the breast. The baby should be positioned so that their body faces the mother almost entirely, with just a slight turn to allow eye contact. This position helps the baby latch on well since most nipples point slightly downward. If the baby faces the mother too directly, they may lose their grip on the breast. The third is that the whole body should be supported. The mother should support the baby's entire body with her arm along the baby's back. This is especially important for newborns and young infants. For older babies, supporting the upper body is usually sufficient. The mother should be cautious about using the same hand that supports the baby's back to hold their bottom, as this can cause the baby's body to shift too far to the side, forcing the baby to bend their head forward to reach the nipple, which can make suckling difficult. The last but not the least, the baby facing the breast with nose to nipple approach. The baby should be positioned so that their nose is aligned with the nipple, ensuring a proper latch onto the breast. Building on our understanding of proper positioning, let's explore some alternative ways to position a baby while sitting. If you see in this picture, the mother is holding the baby in the underarm position, which is also called the football position. The four key positioning principles remain crucial. The mother might need to use pillows to support the baby at her side. The baby's head should rest gently in the mother's hand without any pressure toward the breast. This position is particularly beneficial for breastfeeding twins, mothers who struggle with attaching the baby across the front, addressing a blocked duct, and feeding very small or low birth weight babies. Mothers can also hold the baby with the opposite arm to the breast. The same four key positioning principles apply. If breast support is needed, the mother can use the hand on the same side as the breast. The mother's forearm supports the baby's body, while her hand supports the baby's head at the level of the ears or lower without pushing the baby's head back. This technique is especially useful for very small or low birth weight babies, babies who are sick or have disabilities, mothers who find this method more comfortable than others. Continuing from the various breastfeeding positions, let's now look at how to assist a mother with breastfeeding while lying down. Guide the mother to lie down comfortably on her side in a position that allows her to relax, similar to how she would sleep. Propping her up on one elbow is usually not comfortable. If available, pillows can be placed under her head and chest for additional support. The same four key positioning principles apply when breastfeeding in a lying down position. The baby should be straight, close to the mother, supported and facing the breast. The mother can support the baby with her lower arm, while her upper arm can be used to support the breast if needed. If she doesn't need to support the breast, she can use her upper arm to hold the baby. A pillow or rolled cloth behind the baby's back can help keep the baby in position. A common issue when breastfeeding lying down is that the baby may be positioned too high near the mother's shoulder, causing the baby's head to bend forward to reach the breast. Breastfeeding while lying down allows the mother to rest and breastfeed simultaneously, especially useful if she wants to sleep without getting up. This position can be particularly helpful after a cesarean section, as lying on her back or side may make breastfeeding more comfortable. Again, building on the benefits of breastfeeding in various positions, let us now consider the reclining position. The mother leans back and is supported by pillows. She should lean back far enough, ensuring she isn't completely flat so that her body supports the baby, who can be placed naked on her bare chest for skin to skin contact. This position is particularly helpful when a baby has difficulty latching onto the breast or is fussy and crying. The calming effect of this position often encourages the baby to instinctively find their way to the breast much more like a newborn. This approach is sometimes referred to as the biological nurturing. Exploring various breastfeeding positions reveals that each offers unique benefits and caters to different situations. There are numerous breastfeeding positions that mother can choose from, each offering unique benefit and catering to different situations. Breastfeeding is a personal experience and the ideal position can vary depending on the comfort and needs of both mother and baby. The choice of positioning often depends on factors such as baby's age, the mother's body shape, and any specific challenge they might be facing, such as latching difficulties or an oversupply of milk. Some of the additional breastfeeding positions can be standing. A mother can also breastfeed while standing. Propped forward. If the baby struggles to latch, the mother might try lying on her front, propped on her elbows, while the baby positioned underneath her. Leaning over. For mothers with very large nipples, leaning over the baby and offering the nipple from above can be effective. Managing oversupply. If the mother has an oversupply of milk leading to a fast flow, lying on her back with a baby on top can help regulate the milk flow. Common mistakes by mothers and health workers can make it difficult for the baby to latch onto the breast and suckle effectively. The most important issues are the positioning issues. The baby may be too high, too low, or too far to the side, causing the baby's mouth to be misaligned with the nipple. For instance, if the mother holds the baby's bottom on the same side as the breast, it can pull the baby too far to the side, making it hard for the baby to latch properly. To avoid this, the mother should support the baby's back with her hand, ensuring the baby's head rests on her forearm, not in the crook of her arm. Other issues are with the breast holding. Holding the breast too close to the areola, pinching the nipple, or using the scissor hold can make it difficult for the baby to latch and suckle. The scissor hold can also block milk flow. Holding the breast back from the baby's nose is unnecessary and can pull the nipple out of the baby's mouth. If the baby's nose seems too close to the breast, it may be because the baby is positioned too far to the side. Repositioning the baby with his heads on the mother's forearm can help. Other issues are with the health workers. Like the health workers sometimes may make the mistake of positioning the baby themselves instead of guiding the mother to do it. They may push on the back of the baby's head to force the baby to latch. This can cause the baby to resist and refuse to breastfeed, preventing the mother from learning how to position her baby and gaining confidence. To wrap this session, let's focus on the key steps for guiding a mother in positioning her baby effectively for a successful breastfeeding experience. You need to engage with the mother. Start by greeting the mother, inquiring about her breastfeeding experience, and assessing a current feeding session to understand her needs. You also need to ensure that she is comfortable. Make sure both you and the mother are in a comfortable, relaxed position to facilitate a smooth demonstration. Next come guiding the baby's position. Explain and demonstrate how to hold the baby correctly, focusing on these four key aspects. That is, the baby's head and body should be aligned. The baby should be held close to the mother's body. The baby's whole body should be supported. The baby should approach the breast with her nose aligned with the nipple. Then we need to demonstrate breast support. Show how to support the breast properly, positioning the fingers away from the nipple to avoid obstruction. We also need to guide the attachment process. Assist the mother in helping the baby attach effectively by touching the baby's lips with the nipple, waiting for the baby's mouth to open wide and then moving the baby onto the breast. This we also saw in the previous session. Look for these signs of good attachment. The baby's mouth is wide open. The baby's lower lip is turned outwards. The baby's chin is touching the mother's breast. More areola is visible above the baby's upper lip than below the lower lip. Then last but not the least, you need to deliver feedback and adjustments. Observe the mother and baby's responses, inquire about the comfort of suckling and check for signs of good attachment. Make necessary adjustment and try again if needed. In session 4 on breastfeeding, perfecting the art of positioning and effective latching, we understood that ensuring proper breastfeeding positioning is crucial for both mother and baby, as it promotes effective latch, comfort, and successful feeding. In session 5 on breastfeeding, managing breast conditions, we will understand how to diagnose and manage several common breast conditions that sometimes cause difficulties with breastfeeding. We invite you to share your thoughts, questions, or any topics you would like us to cover in future sessions. Please feel free to reach out to us via email at rajinder_gulati@hotmail.com. Your feedback and input are invaluable to us as we strive to create informative and helpful content. Thank you for joining and looking forward to continuing this journey together. Have a wonderful time ahead.